Hi, my name is Angélica. I'm a professor from the Department of Gynecology and Obstetrics and also Physiotherapy and Occupational Therapy at Paulo State University. The work I'm present is titled Vaginal Birth in Low-Risk Maternity, 8 Years Retrospective Study. The international healthcare community has considered the ideal rate of cesarean sections to be between 10 and 15% due to the benefits to child-mother binomial. Thus, in the last decade, there was a movement to increase the vaginal rates. The use of operative and assisted vaginal delivery with episiotomy, vacuum, or forceps are believed to carry increased risk of perineal trauma, and it's associated with pelvic floor disorders and should be restricted to complicated cases. So the aim of this study was to evaluate the mode of delivery through 8 years of assistance. It was a retrospective cohort study consulting the data bank of low-risk maternity from 2011 to 2018. The clinical and obstetric data collected were maternal age, gestational age of delivery, number of previous pregnancies, number of prenatal consultations, labor induction, labor duration, interventions during the vaginal delivery, and route of delivery. Were analyzed around 90,000 records of the maternity. The ages of the majority of participants were between 19 and 34 years old, and the predominant gestational age was between 38 and 41 weeks. The majority of the participants was primiparous, and the number of predominant prenatal consultation was between 7 and 9. The predominant mode of delivery was vaginal mode with a rate of 63%, and cesarean mode was 37%. The distribution of vaginal delivery among 8 years are expressed in this figure 1. Year-over-year analysis showed that was a decrease in frequency of episiotomy between 22%, around 22%. The increase, there was an increase of 13% in births without intervention and perineal complications. Regarding grade 1 laceration, its frequency fluctuate over the years, range 16% to 28%. It was observed that in 2016 and 2017 were the years that have the highest prevalence of this occurrence. The same behavior occurred with grade 2. It was observed that in 2014, 15, and 16 were the years that have the highest prevalence of occurrence. Grade 3 and 4 laceration, and the occurrence of episiotomy with laceration decreased along the years, accumulating 2018 without registration case. It was observed that in 2016 was the year with the highest number of episiotomy with laceration. Of the use of forceps range from 0% to 0.7% of the case. So we concluded that the average of 8 years of cesarean section rate is higher than recommended. Although the episiotomy is still higher, it's increasing a long time, followed by an increase of laceration rate 1 and 2, and then no intervention of vaginal delivery. As perineal interventions during vaginal delivery can be associated with maternal pelvic dysfunctions, strategies that reduce the need for operative vaginal delivery should be implemented. Thank you.